Hello and welcome. Thank you for joining me. My name is Joey. I'm with Medoma, and this series is over the 7 simple tips to help relieve your back-related issues. This video specifically is going to go over the tips 1, 2, and 3. We're going to dive into heat versus ice debate. We're going to talk a little bit about whole body heating and then over-the-counter medications. So what do you plan on, what will you get out of these tips basically? And my goal is that you will know how to crack the code of ice versus heat, how useful a hot bath for relief and overall health is, and of course, what over-the-counter medications are best for back pain. If you have to reach for the medicine cabinet, which ones should you, and what are some options out there? And why is this important? This is a staggering statistic, but 100 million unlucky people in the U.S. deal with chronic back pain. As much as 80% of the population will experience a back problem at some time in their lives. Chances are that includes you. You're listening to this, you're watching this, and you know that if symptoms go unaddressed, they can lead to bigger issues. If there's an alarm going off in the house and you don't do something about figuring out where the fire's coming from, it's going to spread. And that's really what this aches and pains and back-related issues comes down to, because if you don't have things sorted out, your productivity, your activity, and your quality of life are all affected. And what will you get out of these tips? I really want you to be able to make the best choice to get relief, so you can get relief and recover faster. That's all. The healing game is all about time. It's all about getting something addressed and really avoiding the wrong solutions. If you do something incorrectly, it only causes more problem, it wastes your time, and it slows the healing. And then knowledge is power. I really want you to gain the knowledge so you have the ability to always help yourself and others that you care about, loved ones. Let's jump right into the age-old debate, the battle of ice versus heat. And there are very specifics around this. So ring the bell, ding, ding. Let's see who comes out on top. Ice pack or heating pad. Now think of ice. It really is for immediate injuries. You want to put something cold on something when it's inflamed, and inflammation usually comes from a typically acute injury within the last 48 hours. Ice is designed to calm down superficial tissues that are inflamed, red, hot, or swollen. Now let's focus a little bit on inflammation. Inflammation actually, believe it or not, is healthy, normal, and a natural process. It also happens to be incredibly painful. So icing is just a way to mildly and druglessly dull the pain and inflammation. By decreasing the inflammation, it actually helps momentarily spur on the healing process by introducing new blood and circulation. But heat actually is what you want to move to after a short stint of ice, or use heat on muscles for chronic pain and even stress. So chronic issues, usually several days to weeks or months, years old, really require heat. And often these symptoms are described as being achy, stiff, they have knots in the muscles. Heat can take the edge off and soothe that. Heat and inflammation are really particularly a bad combination. So you can also do potential harm whenever you do use these incorrectly. So of course you want to put ice on the hot and heat on the cool. When your body's already hot, putting heat on it is probably not the best. And when your body's already cold, putting cold on it is not the best. So and you never will be successful if you put more fire on a fire to put out a fire. So no fireman's ever been successful doing that, I don't believe. So keep that in mind. Ice, immediate, heat for long-term and muscles. Let's dive in a little bit more and talk about the healing powers of a heated whole body bath. Now, heat in general, though especially the whole body, dilates blood vessels and increases blood oxygen levels to these areas that need healing, as well as nutrients. Heat stimulates the sensory receptors in the skin and helps decrease the transmission of pain signals to the brain. They've actually done a lot of research around this, because many cultures swear by the benefits of a hot bath, but science is just now coming to an understanding of this passive heat idea to improve health. A university, Loughborough, and investigated the effect of a hot bath on calorie burning and inflammation management. They took 14 guys had them soak for an hour in a hot bath of 140 degrees Fahrenheit. The thing was steaming, and they measured how many calories the men burned. Now, they burned not as much as you would say maybe riding a bike or something like that, but sitting in a pool of water that's hot, they burned 140 calories in this hour, which is equivalent to maybe doing a half an hour walk, a brisk walk. So they repeated these effects over and over, and they showed that repeated passive heating may contribute to reducing chronic inflammation, so full body chronic inflammation that's often present in chronic pain issues and long-term diseases such as type 2 diabetes. So you are given full permission to allow yourself to soak in a hot bath to help relieve these aches and pains. Super beneficial for long-term health as well as immediate effects to bring down pain and achiness. Pills, potions, and lotions. So if you have to reach for it, reach for the right stuff. And over-the-counter medications, of course, have their side effects, but the non-steroidal anti-inflammatory drugs are probably the most common that are recommended for back pain by medical professionals. These are ibuprofen, naproxen, aspirin, to name a couple. A lot of actually medical professionals are moving away from, of course, oral medications because the systemic side effects and long-term effects they can have with long-term use of oral medications, and they're using a lot more topical forms, things that will stay, superficial, can often have less than 3% absorbency to your body, and doesn't have those long-term cognitive, addictive, or systemic issues to organs. Essential oils are very popular. They're coming out with more and more new combinations, new derivatives for essential oils, but lavender and rosemary in particular have shown to be beneficial to reduce inflammation and help relieve joint pain. So again, topical forms, doesn't have to be medication. There are a lot of medical, non-medical solutions out there, but those are a couple that if you need immediate relief, but of course rehab and ice and taking care of things long-term are a great solution. So in conclusion, make the best choice. Make the choice that's right for you, for your family, price point wise, time wise. But what it comes down to is you want to address this and make the most out of your decisions. And that's becoming educated, empowered. And that's what we're all about. And that's really where your health becomes yours. So I wish you the best. And thank you so much for watching. There are more tips to come. Please tune in for those. Thanks so much. Hey, before you go, if you enjoyed this content, you would probably benefit from our intro massage package we created for new clients. Just click the Learn More button below to find out more. Thanks again for watching.